Our time now is 6:21, and sometimes aging can bring on new aches and pains and unfamiliar illnesses, and while some people chalk them up to nothing more than just getting older, some common conditions could lead to some serious health issues if they're left untreated. And Dr. Nguyen with the LSU Health and Sciences Center and also People's Health joins us now with some warning signs, and thanks for coming in.
Absolutely. Thank you for having me.
You're welcome. And I can imagine these are things that people, they don't want to address because they're getting older and they don't want to think that, okay, I have this issue.
Right.
And one of them is urinary incontinence.
Yes.
And what are some signs that that is setting in?
So oftentimes we see this a lot in both men and women, but definitely more commonly in women. Some women definitely will complain about, oh, I had a little bit of urinary leakage when I coughed or when I sneezed. So depending on the underlying cause, there are different things that we can, that you should seek your doctor in terms of treatment, because they can do simple things such as bladder training exercises. And if it's related to, if it's from frequency and just basically having urge incontinence, there are different medications that they can use to treat that. And sometimes it's something as simple as just a urinary tract infection that can be treated with antibiotics. So if that is a problem, I encourage patients to talk to their doctors about it and not blow it off.
And what happens if it's left untreated? Could it escalate into something more serious?
Typically, yes, it can, but usually it's something that's slow and progressive, and so, it's nothing that you have to see your doctor for urgently, but we do recommend it because it can interfere with quality of life.
Oh, yeah, and I can imagine it's something that you don't really want to talk to your family and friends about, so go see the doctor. They don't care, right?
Absolutely.
And as far as vision loss is concerned, how many people does that affect in the golden years?
That's actually very, very common, and actually it happens in 1 in 3 people over 65, and so it's a major safety and health concern. And the common causes are, macular degeneration, cataracts, glaucoma, and so obviously if you are having vision changes, you should talk to your doctor about it. We usually recommend patients get their eyes checked every 3 years or so, and then especially in diabetic patients, we recommend it annually.
Macular degeneration, I know that can be serious over time, and you can go blind.
Absolutely,
and
it's a common cause of blindness in the elderly, and so all of those can be common causes of blindness, and so we definitely recommend seeing an ophthalmologist for those cases.
And there is treatment out there, and of course cataracts, I've heard about.
Yes, cataract surgeries, glaucoma, there are a lot of different medications that they can use to delay the progression depending on the type of glaucoma.
All right, and then also something that affects older people, memory loss.
Yes, yes. We get a lot of patients who say, you know what, I don't know if it's Alzheimer's versus just regular age, cognitive decline related to aging. And so, usually we say, if it's interfering with your quality of life in terms of, you're not remembering your family members, you're not remembering how to do your day-to-day functions, usually that's whenever you should be evaluated by a doctor. We usually recommend patients, get plenty of sleep, stay social. I usually tell my patients to keep that mind going, do crossword puzzles, yes. Keep your mind active, and that usually will help.
Sometimes I forget what I did yesterday
I'm the same way.
I know, so I mean, it can happen in younger people too, but when you get older, you should see a doctor. All right, Dr. Nguyen with LSU Health and People's Health.